introduction. And to start with, we would like to understand a term which is very important, is asymptomatic bacteria. What does this mean? In general, asymptomatic bacteria means presence of bacteria in urine, either identified through culture or even through urine analysis. And asymptomatic bacteria is uncommon in young adults, but increased significantly with age in both sexes. The prevalence of asymptomatic bacteria is estimated to be between 6% and 10% in women older than 65 years old, and it's less in men, but nevertheless still important, that may reach 5% of all men above 65 years of old may have asymptomatic bacteria. Now, for people with symptoms of urinary tract infection and bacteria, the main aim of treatment is eradicate the infection and relieving the symptoms. For people who are asymptomatic, the main outcome from treatment is prevention of infection and symptomatic episodes. So that's the difference in concept when we deal with asymptomatic bacteria. And also to understand that treating asymptomatic bacteria whenever it's found with antibiotic may lead to unnecessary use of antibiotic, and we also may lead to increase in resistance of bacteria to antibiotics. Now we'll go to infection, which is in general classified in different ways. The common way of classification is anatomical level of infection, and that is, we'll come to it according to the organs, or even classified to grade of severity of infection, underlying risk factors, and also microbiological findings. All are acceptable way of classification. When we look at the level of infection, starting from down to up, urethritis, which is usually in young males, is the lowest part of the urinary system, and it's limited, the infection limited to the urethra. When it affects the urinary bladder, it's called cystitis, and when it affects the kidney, either part of the whole urinary tract system or just the kidney infected, called pyelonephritis. In severe cases, there may be signs of sepsis, where the bacteria or the toxins are circulating in the blood, and that case called sepsis or urosepsis. The least grades of infection is the cystitis, although it's quite painful and causes a lot of burden on the patient. But when we look at the cystitis, is much less in severity than pyelonephritis, where you have generalized symptoms, and urosepsis, where it becomes life-threatening condition. Organisms can affect urinary tract systems are of different types. In general, we group them into non-specific, where mostly bacteria, and specific, such as tuberculosis or fungi. Looking at the bacterial infection, which affect the urinary tract, from different studies, the collective reviews showed that Escherichia coli, which is a gram-negative bacteria, is the most common type of bacteria affecting urinary tract system. It may reach up to 63% of the total percentage of the total infections that affect urinary tract system. Then followed by Klebsiella, Pseudomonas, and Proteus. Those data are collected from different studies, including inpatient and community-based infection. But when we look at the specifically community-based infection, that we find the bacteria related to the lower GI is the most common, just as E. coli and Enterococcus. Now, children as a group of patients are more prone to infection, especially if they have dysfunctional voiding. That may associate up to 40% for toilet-trained children with UTI, and the recurrent UTI increased up to 80% association with dysfunctional voiding. Females are more prone to infection than males, and that's understandable because of the short urethra, preterm, low birth weight, and uncircumcised males all are predisposing factors to infection. On the other hand, on the aged patient, variety of factors predispose to infection, such as adaptive and innate immunity, may increase susceptibility to infection due to different reasons. Multiple medical comorbidities often increase the risk of hospitalization due to infection, and in hospitalization also the risk of infection is higher due to intervention, perform different procedures, or placement of different devices.